Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Tanjuatco-Trillo. Today on the program, a top PhilHealth official says the state insurer's actuarial life may not extend between 2027. Health experts say it's too premature to lift the mandatory mask mandate. And PhilHealth Vice President and Spokesperson Shirley Domingo and Private Hospitals Association of the Philippines President Dr. Grano join us live. The Philippine Health Insurance Corporation, or PhilHealth, says due to funding challenges, PhilHealth actuarial life may not be extended beyond 2027. In a House hearing, PhilHealth OIC Dino says they should source more funds from different government agencies or through sin taxes. PhilHealth is set to receive some 34 million pesos for the 2023 budget. Now let's go straight to the source of the story with PhilHealth spokesperson Shirley Domingo. Ma'am, good morning. Thank you for being here.
Hello, good morning, Ria. Good morning to everyone who's listening or watching us right now.
Now, ma'am, in a budget hearing on Monday, PhilHealth OIC Eli Santos says that the actuarial life of PhilHealth may only last until 2027. And understandably, this has raised a lot of concern among PhilHealth contributors.
Hello?
Yes, can you hear me, ma'am?
Yes, nakat ka, but it's okay now. Sige.
Okay, so could you tell us exactly what it means when it's said that PhilHealth's actuarial life will only be until 2027?
Okay, first of all, I would like to say that our finances are robust. We have a reserve fund as of December 2021 of 177 billion. So now, what our president, OIC president, was referring to was actually an actuarial study. It is an actuarial study done by our actuary. Actuarial studies has assumptions, scenarios, and projections, and different conditions. No, and he was citing one of the scenario, but we have a lot of activities to counteract the required, increase in collection efficiency and benefit development in order for us to make sure that the fund is robust.
All right. Now, something else that Santos said was that if the state insurer receives all the subsidy from the government and if they implement PhilHealth's programs, it will last beyond 2027. So could you talk to us a little bit, please, about what exactly these subsidies are, and if ever, what would prevent PhilHealth from getting them?
Yeah, that subsidy we are requesting from national government. There are two types of subsidies. One is a subsidy for the premiums of the indirect contributors. And the other one, just recently, the PCSO and PAGCOR and the Universal Healthcare Law will remit some funds to the Treasury for PhilHealth also. But this subsidy is specifically for benefit improvements. So these subsidies is what we were referring to when the national government is providing us subsidies. Now, as to your second question, what can be done to extend the life of the fund life of PhilHealth? Well, as I said earlier, there are different factors that depend, that the fund life depends on in the case of PhilHealth. No? Our collection efficiency for contributions of all our members, remittances from national government, now remittances from PCSO, PAGCOR. Of course, the way we utilize the funds when we pay for benefits, when we enhance our benefits, can also contribute to fund life. So all these factors are being addressed and taken care of to, as I said, to ensure a long fund life for PhilHealth.
What kind of legislation, if any, would you need from Congress to extend the fund life of PhilHealth?
There is already an existing legislation, the Universal Healthcare. The Universal Healthcare ensures that everything, all the reforms that was embodied in this law is funded. As I said earlier, the PCSO PAGCOR is one of the source of funding. In fact, yesterday there was a ceremonial transfer of funds from PCSO to the National Treasury, which is for PhilHealth benefit enhancement in the amount of 2.5 billion. So we're discussing all this with our fund managers of the Philippines, and we're also discussing this with Congress to make sure that the fund of PhilHealth is robust.
Right. And, again, in a situation like this, you would need lots of different options because there are so many different scenarios. What options have you plotted out in case you can't source funding?
Well, right now, as I said, we have funding because national government gives us subsidies every year. And starting this year, PCSO and PAGCOR is already giving us also funds. Aside from the contributions that we get from our members, last year we were able to collect around 171 billion in contributions. And aside from the national government subsidy, as I said earlier, they give us an amount every year. So I think we're okay. We're okay. The scenarios include the benefit enhancements that is mandatory under the law, and therefore this also has an effect on the fund life. Enhancements include expansion of our preventive packages, review of our case rates to make it more to increase the support value to our members and the like, big expansions, mandatory under the law. So what we do is to progressively realize, that's also part of the universal healthcare law, to progressively realize all the reforms that's embodied in the law. And of course, before we implement a benefit, we have our actuarial review it if it's within our funding, if it's allowed within our funding. So all of that we do to make sure we have enough funds to fund through the years.
All right, ma'am. So how do you feel, or how do you think that the statements on PhilHealth's actuarial life reflect on the public healthcare system structure, especially with the ongoing COVID-19 pandemic and now the threat of monkeypox as well?
As we said earlier, I want to emphasize that the fund life, although it depends on several factors. So the 2027 was just an estimate, an actuarial estimate, but depending on the scenario. With regards to the responding to all these health challenges, we have the funds to address and pay any claims that will be brought to us. I mentioned earlier that we have a 177 billion reserve fund for any eventuality.
Right. Ma'am, what would you like to say to contributors who heard this news and are getting worried about the possibility of the 2027 deadline?
Yes, we would like to say that PhilHealth's funds, the funds that you contribute to us, your funds, is being managed well. We are being monitored by financial managers, as I said earlier. And we invest some of the funds to be able to get some additional funding. Last year, we were able to have an earning of 9.5 billion through investments. And therefore, we are doing a lot of activities, doing a lot of things to make sure that we manage this fund well and that it will extend. As I said, the 2027 was an actuarial projection, only one of the scenarios, different scenarios that were being studied by our actuary.
Okay, so to be clear, that 2027 date was hypothetical. But, most Filipinos really only have PhilHealth and not much health insurance. Do you feel that, understandably, with these statements coming out, they're worried? Do you think their medical needs need to be covered additionally? Do you suggest that if they can afford it, they get private coverage as well?
Yes. Well, if they can afford it, yes. But we are doing everything to make sure our support value in other words, the amount we pay with regards to their hospital bills or medical needs are enough. No, it's high. Our support value. That's also one of our plans at the moment. Review of our case rates to increase our support value. Review also of our Z benefits, which are catastrophic benefits, to make sure again that we will be able to pay for as much as we can based on that hospital bill. We still cannot pay 100%, of course, of all this hospital bill, although we have this policy of no-co payment for selected membership sectors in government hospitals. In fact, the Universal Healthcare Law also has a provision that says if they are confined in basic accommodations, then it should be no co-payment. But this is only in 10% of beds in private hospitals, 70% of beds in specialty, and 90% of beds in government hospitals. So there are provisions in place to try to make sure that government pays for as much as we can for hospital bills if they're hospitalized, or medical payments for selected outpatients that PhilHealth covers.
All right, ma'am, you are set to receive 34.99 billion pesos in 2023. Talk to us a little bit about what the spending priorities will be for PhilHealth.
For 2023,
That's
excuse
right.
me, what was the question again? I'm sorry.
Yes. For 2023, what are the priorities given that you are set to receive 34.99 billion pesos?
Yes. Well, in fact, we are, for next year, the subsidy will amount, if approved by Congress, 100.2 billion. 80 billion for the premiums of the indigent. The indirect contributors, and around 31 billion coming from PCSO PAGCOR for benefit enhancement. Now, our priorities, we have identified our benefit plan already for starting this year up to several years from now. One is to review our rates to be able to increase our support value. Secondly is to look at additional benefits, like, for example, our dialysis. We are increasing it. We have increased it this 2022 to 144 from 90. We are still studying to further increase it, because 144 is still not enough for dialysis for the whole year, assuming 3 dialysis sessions a week. So that's one. We're looking at coming out with other benefits, like for severe malnutrition, for cancer, our cancer benefits specifically for breast cancer, prostate cancer, kidney transplant. We're paying around 600,000 for kidney transplant. So we're looking at all of this to be able to expand our support value. So all of that will cost us financially.
All right, ma'am. Thank you so much for speaking with us this morning. We do appreciate it. That was PhilHealth spokesperson Shirley Domingo. Coming up, health officials are stressing the need to get the booster shot now that the face mask policy has been relaxed. Private Hospitals Association of the Philippines President Dr. Jose Rene de Grano will join us next. Stay tuned. You're watching The Source on CNN Philippines. I'm Tanjuatco-Trillo. Health officials are stressing the need to get the booster shot now that the face mask policy outdoors has been relaxed. How do people cope on the second day of voluntary wearing of masks outdoors? Caroline Bonkin has more.
We've seen many people who still chose to wear face masks outdoors, even if it's now voluntary, but many are also removing their mask when in open spaces. COVID-19 cases are manageable as many are already fully vaccinated. For people like Hubayan and Jamela, this is enough reason to feel safe to go maskless outdoors.
Safe na ngayon, hindi tulad ng dati na as in talaga maraming case ng COVID-19.
Vaccinated na po ako. Feeling ko po safe na po ako. Pero okay lang naman din po kung mag-face mask din po para double safe.
There are those who feel comfortable walking under the heat without face mask.
Mas okay kasi parang nahihingal sa kakalakad.
But Jobber is more relieved about the money he could save.
Kung makailang mas ka rin sa isang araw, kaya makawalo ka, may 1 kilong bigas ka na eh. Sayang din.
There are also others like Rene who still prefer to wear face mask.
Mas safe pa rin kung naka-face mask ka. Tsaka minsan hindi na rin sa virus, yung alikabok, yung makakasabay mo sa pagbibiyahe, yung mga naamoy mo.
So is Melissa who has an existing disease.
Unang-una, diabetic ako. Ayoko rin ma-expose.
As the outdoor face mask policy eases, health officials are asking the IATF to help increase the booster coverage. The country is just 6% away from the wall of immunity if one will look at those who had been fully vaccinated. But our protection from the primary vaccine series wanes. For infectious disease specialist Dr. Ron Jean Solante, the Philippines' wall of immunity is still not robust because the boosted population remains low.
Where can you get that wall of immunity? A sustained wall of immunity in the boosted population is low.
The DOH official agrees, saying they're now aiming a 30% booster coverage by October and 50 to 70% by year end.
The actual wall of immunity that we are aiming for would be for us to improve our booster shots because we know that this additional dose would up our immunity to around 80 to 85 against severe and critical.
DOH is asking the IATF to help give incentive to boosted individuals.
Sa mga nagpupunta sa mga local tourist destinations, baka sakali, pwede, nahihingan natin sila nung card nila na may booster dose sila para sila makarating sa ibang lugar. Sa ating ibang ahensya, katulad sa transport sector, maaaring magkaroon ng additional incentive din ang ating mga na-boosted na individuals.
Vergeres says it's not yet time to relax the face mask policy indoors and in crowded areas. They will recommend the mandatory wearing of masks outdoors again if more people get hospitalized and when severe COVID infections and deaths rise again. Caroline Bongkin, CNN Philippines.
Our source today, Dr. Jose Rene de Grano, President of the Private Hospitals Association of the Philippines. Good morning, Dr. de Grano. Good to have you here.
Yes, good morning, Ria, and to all our viewers out there. Yes.
Sir, can we get PHAPi's reaction to the optional face mask policy?
Yes, right now, actually, most of us, the medical community, still thinks that it is very early or too early to give that mandate, because right now I think it gives a sense of complacency. Para bang okay na, we are safe. We're not yet safe. It has to be emphasized. Now, right now we're still having 2,000 to 3,000 cases a day, and around 25,000 cases total cases for the country. So the infections is there, Andiyan pa rin na infection. Ang akala nila, hindi na ito magmamask kasi okay ka na, nabakunahan ka na. But no, it's not like that. Opo.
All right. And speaking of these cases that, as you said, we are still seeing on a daily basis, kamusta na ho ang mga hospitals in terms of COVID-19 cases? What percentage of hospital beds are occupied by COVID patients right now?
Right now, we're supposed to give 20% to COVID cases, but right now the allocated beds usually they only occupy around 5 or at most 10% right now because the symptoms are mild. Medyo hindi naman dumadating to the point na kailangan silang i-admit except for those na merong mga immunocompromised or pre-existing diseases. Pero right now, it is manageable because most of the patients who get positive ay nag-stay na lang at home and they are trying to quarantine themselves for about a week, 7 days, and then after which, okay, they can go around again. Yes.
All right, sir. So you're saying 20% of hospital beds should be allocated for COVID, and right now, of those, that 20%, mga 5 to 10% na lang na-occupy because of COVID. Could you talk to us a little bit about the illnesses of the other patients who are in hospital right now? What are your hospitals busy treating aside from COVID?
Well, there are a lot of infectious diseases right now because of that. This is what we call the last quarter of the year, because of the weather, siguro ganun. We have a lot of dengue cases, we have a lot, sometimes with leptospirosis, with typhoid, and then of course flu. And then they have the same symptoms, like COVID. So you just have to be tested so that you'll know if it's really COVID or just another viral infection. So yun ang namin, sine-check right now. But then pag mild lang ang symptoms, they do not want to be confined in the hospitals unless they have, of course, pre-existing diseases.
Right, sir. Now, Octa Research reported a slight uptick in COVID cases again this week. In fact, they said in the province of Rizal, it's actually a spike. Is this something you're worried about?
Of course, when we began the face-to-face and now the optional wearing of the mask, medyo we are worried that it may again trigger a surge of new infections. And the problem with our hospitals, we are ready with the physical number of beds, but sometimes the problem right now is we lack nurses. And if you don't have that enough manpower, then dun tayo malilimit ang pag-admit natin ng mga cases na to.
Okay, we will talk a little bit more about that in a moment. So do stay with us, Dr. De Grano. For now, we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Tanjuatco-Trillo, and our source today, President of the Private Hospitals Association of the Philippines, Dr. Jose Rene De Grano. Doctor, welcome back to the program. Now, before we took a break, you mentioned manpower. So we have the physical beds, but what might be difficult is a lack in manpower. Talk to us more about this. How big is the lack in manpower? How many more positions need to be filled in order for the Philippines to be in a comfortable place to treat people in case there is another surge?
Well, even before the pandemic, there was a big exodus of nurses already. From the private hospitals, our estimate is more than 40% of our nurses went out, and so that's the problem. Pero right now, not only nurses, we lack medical technologies, we lack respiratory technologies, we lack pharmacists, radiology technologies, and those things, and those personnel who are really a big part of the hospital. So and now we're seeing that government is trying to promote these things, and parang binibenta pa nga nila itong ating healthcare workers abroad. Even the Department of Labor, they're trying to say na, okay, you can get our healthcare workers, you can get them from the Philippines. And what happens now to our healthcare system? It will eventually collapse if we don't have the enough manpower to man these hospitals right now. So actually right now, the Department of Health is some of the CHD, that's what we call the regional offices, are very strict. They are warning, especially in Region 2, they are warning private hospitals that if you cannot come up with enough manpower, then there's a chance that they will be closed, that the hospitals will be closed. So that will happen if we don't stop, the exodus of our healthcare workers.
All right. Doctor, what are your suggestions to solve this issue? Of course, again, for the individual healthcare workers and nurses, while we need their skills here, they also want to earn as much as they can for their families. How do we balance the two?
Well, of course, yes. The problem is, the Philippine economy is just like that, How can we increase the salary of these people unless we increase the hospitalization cost of the patients? That's where we get our the money to pay the salaries of our employees. It's unlike government where they have a budget for that, and these are paid for by the taxes that the direct contributors are giving. But for private hospitals, if we want to, keep at par with these government salaries, then we have to increase the cost of hospitalization of our patients. And of course, even if we increase it to around 33 to 35,000, we cannot match the offer of the foreign countries, amounting to more than double of that amount. Who can stop this? Even if you increase it to 50,000 a month, you think that will stop the nurses from going out? It will not. Only those nurses who still, because of their family, they want to stay here because they want to complete their family. But a lot of our new nurses now are very young, adventurous. They want to go out. They want to improve themselves. And, we can't stop them. So the most that probably government will have to do is to limit first, and then see whether we are producing enough of these healthcare workers before we let them out, because otherwise that will cause the collapse of our healthcare system.
It's a very difficult situation there. Doctor, thank you so much for being here with us this morning. That was Dr. Jose Rene de Grano, President of the Private Hospitals Association of the Philippines. And thank you for joining us here on The Source. I'm Tanjuatco-Trillo. You're watching CNN Philippines.